Now, the Prime Minister says he's going to be laying out a plan this week to explain how we can get our economy moving again. So should we expect to see some of the lockdown measures eased?
Well, we'll have to wait to see what he says, but I don't think we should expect us to go from, this situation that we have at the moment, social distancing, to back to where we were in February. That's clearly not going to happen. I don't think anyone imagines that for one moment. And the most important thing is, I think this is the absolute sort of focus of what the Prime Minister will be announcing later in the week, is that what we do going forward doesn't undo the brilliant work people have been doing to get that, as you mentioned, the R number below 1, the all-critical reproduction rate doesn't come back up, because that's when we'd see a second spike. So, no, I'm afraid it's definitely not going to be business as usual, but we do want to make sure that people understand where the route map lies.
Yeah, I don't think anyone would be expecting business as usual, but as you say, that kind of desire to see a bit of the route map is something that many people will feel quite strongly. There are reports today that primary schools could be one of the things that the government is prioritising. The date of June is being thrown around. Now, I know you, of course, you won't want to be drawn on when any of these measures could happen. That's, I'm sure, very much still something that's up for debate. But could you confirm that getting primary schools back is something that the government is prioritising?
Well, of course, we want the economy to work again. We want schools to work again. We want people to be able to go back to work and businesses to open. All of those things. But it's also the case that we're still working with teachers, and in the case of schools, teachers and parents and schools themselves, as well as the scientists, to work out what and when would be safe. So, to answer your question straight, of course, there's a huge desire to get everything back to normal, but we have to make sure that we've satisfied those key 5 tests that we set out, of which the most important, you'll recall, was that we don't spark a second wave by not keeping the R number under control, and that means thinking about how we look at social distancing in this world going forward. And testing, tracking and tracing, all of those things are going to be absolutely vital going forward, and that's why there's so much work going on in parallel to the decisions coming forward from the recommendations coming forward, and then later this week the roadmap coming forward from the Prime Minister, to make sure that test, track and trace is in place.
I mean, you say there that there's a desire to get everything back to normal. Of course, I'm sure that is the case. But, I mean, is there any specific desire to get younger children in particular back into education?
Well, look, getting schools going again is one of the considerations. Obviously, my particular area, transport, and how we get that working again is another one. And it is the case that the Business Secretary has been working with various different elements of, business, industrial, and different types, categories of business organisations to work up what the plans might look like. So, it's no secret that, of course, we want kids to be able to go back to school, but I'd be over-egging it to say there's a date in place, there's a plan in place. You will have to wait till later in this week to hear more detail from the Prime Minister on all of these fronts, but I don't want people to be watching this morning thinking, that's it. The most important thing we do is to carry on following the rules for the time being. The Prime Minister will set out the path going forward when he speaks about this at the back end of the week.
You mentioned your own brief there, transport, and the Prime Minister does say that his plan will include measures about how we can travel to work safely. So what kind of thing could we see on buses and trains? Lots of people will be worried about using public transport.
Well, I think it's very important to be able to reassure people when we do get back to people using the public transport more. At the moment, of course, usage is very small, perhaps 5% of its usual level. But I've spoken before about things like, staggering work times. Obviously, very important to avoid those morning peaks, and the crushes would be completely at odds with social distancing. Of course, I'm very concerned about people being able to wash their hands. It's still by far and away the most important advice above anything else, even above face masks and all the rest of it. It's just basic hygiene, the hand washing, that message from right at the beginning. Well, we can help with that by trying to have hand sanitizer, one-way systems, spacing on platforms and at bus stops and that sort of thing clearly marked out. So there are a lot of different measures that can be taken, of which easing into this is going to clearly be one of the most important things of all.
I mean, could we see measures like people being temperature checked before using public transport, or perhaps a limit on the number of people who could get on at one time?
I mean, it is the case, and I should just remind everybody about this. I saw that story the last day or two. It is the case and remains the case that if you feel unwell, if you've got a temperature, you shouldn't be leaving home, because that could be coronavirus. You shouldn't be leaving home, let alone going and getting on public transport. And that remains the case. Of course, the big difference now is, because we've got this big test capacity, is you can go to gov.uk, and if you are a key worker, and increasingly many other categories coming into this, then you can just order a test. I've been on the site this morning. I noticed.
Could we see temperature checks on? Could we see temperature checks then on public transport?
Well, my point is, people shouldn't be leaving home if they're not, if not feeling well. And the thing about coronavirus is the sort of temperature that you feel, or the way that you feel, is absolutely critical to that. So in a sense, you shouldn't be there in the first place.
But some people may. That's the point, isn't it?
Yes, it's possible, but you know, when you think about this, it reminds me of a question I was asked the other day when we were talking about the problems of people obtaining tests and needing to go on the site, and perhaps being a key worker and not being able to get on the site till later today to order a test. And as Jenny Harries, one of the scientific officers, pointed out, people shouldn't be going to work if they feel that way. And the same with transport. They shouldn't be going to work. You shouldn't be going to work if you feel unwell. Of course, right now, the only people who should be going to work are people who cannot work from home, and key workers, and that remains the case. So it's a bit of a sort of moot point, really, about temperature checking on transport. Please don't leave the house if you have a temperature.
Okay, you talked there about the importance of socially distancing on public transport. I just wonder, do you think there'll be a point when you might have to increase the number of services available? At the minute, for example, most parts of the rail work currently operating on a half timetable.
Yeah, that is right, and you know, I'm working very closely with the rail sector, for example, to make sure that we, ordinarily in May, famously in fact, there are normally new timetables, and so we'll still proceed with putting a new timetable into place, but clearly we won't be running anywhere near the full number of trains. But it is the case, as you point out, that gradually we will want to increase the amount of trains available, because preventing that overcrowding, which is going to be a huge logistical task and will require the same sort of determination that British people have shown, and you know, respecting social distancing by following the rules and staying at home, we'll need that to happen, and work with companies and individuals to make sure that happens on our transport system as well. It's so important that we don't lose the gains that we have made in bringing the R number, we think, down now somewhere between 0.6 and 0.85, something like that. So less than 1, remember, means it's not spreading to more and more people. It stops us from getting back onto a curve going upwards, and that's so important, and public transport is going to be a vital part of that. One thing I should mention, it's a massive increase in active transport, in cycling, and we've seen hundreds of % increase in a very popular scheme, which means you can buy a bike through your employer effectively before tax and pay it back through a loan. Those are popular schemes, they always have been, but we've seen hundreds of % increase in that scheme, and I'm going to be saying more about that shortly, because active transport, keeping people off the public transport and getting there under their own steam, getting to work under their own steam, that could be a very important part of this recovery as well.
Now, another part of your brief, of course, transport, will be about whether or not to impose more restrictions on people entering the United Kingdom at ports or at airports, for example. Now, some people will be wondering why it is that we haven't done that already. I mean, South Korea, for example, introduced restrictions from early February. Now test everyone who arrives. You have to quarantine for 2 weeks. They've had 250 deaths. Singapore restricted some flights from China back in January. They've only had 17 deaths. Why haven't we done this already, and are we going to be changing that in the future?
So the first thing to say is we have millions of British nationals to bring back home. Literally, people away. In March, on average, 3 million Brits would go abroad, and many of those had to be returned home, and that process has just been continuing for a while. The second thing is that once it's prevalent within your own society, the scientists, the medical experts tell us there's actually precious little point if it's already within your existing community.
So why didn't we do it before it was prevalent?
Out of this, well, as I say, there were millions of Brits to get home is the first thing.
You can still quarantine them, though.
But we followed medical advice. Sorry, I missed that.
You could still quarantine them, though, and get them home.
Right, and the rules exist so that everybody in this country has to be at home right now. In fact, it's illegal not to be outside your home for one of any other than 4 reasons, as we know. So, I mean, that remains the case for everyone. But going forward, as the number of cases comes down, and therefore the people coming in becomes much more significant. The other thing to say is very few people actually travelling, of course, but as people come in, it becomes more significant once we have, as we're seeing now, a decline in the cases, then I think it does become very much more critical to the overall numbers, and that's why we are actively working on the measures going forward, and we'll say more about those in time.
OK, what kind of thing could we see then?
Well, exactly as you suggest, I think it would be wrong, for example, if we're still all being asked to socially distance for people coming in not to do the same thing. So we'd be looking at things like this app that very soon, in 2 or 3 weeks' time, we're going to be asking the whole country to download, which will help with the test and track and trace, and this is obviously the tracking part of it. That's very important. And we could be, for example, asking everybody who comes here to require to have the app, and the same rules apply to anyone visiting, which is, as you know, to stay locked down effectively. And those same social distance rules clearly would need to apply to everybody under those circumstances.
You mentioned that app, and of course that's clearly going to be a big part of the government strategy going forward as we try to ease the lockdown and keep the R number and the infection rate number down. When is that system going to be up and running?
Right, so that system's going into testing this week on the Isle of Wight, and then later in the month that app will be rolled out and deployed, assuming the tests are successful, of course, to the population at large. And the idea is that we will encourage as many people to take this up as possible. This is going to be a huge national effort. We need for this to work 50, 60% of people to be using this app. Not everybody has a smartphone, I appreciate, and for various reasons not everybody will download it, but it will be the best possible way to help the NHS. In fact, it will be an NHS app. It will be completely confidential. The information doesn't stay on there. You don't know who the individuals are, but what it would do is alert people if they've been near somebody who later is diagnosed as having coronavirus. This is a fantastic automated part of the tracking part of the puzzle, and now we have the testing capacity of over 100,000 tests. As you mentioned, that will continue to rise. This is a fantastic way to ensure that we are able to really keep a lid on this going forward, and we don't get that second wave. So I think it's one of the most exciting developments, and I think, on a Thursday night when people are going out and clapping in future, the ability to do something else of use, which will be to download that app in future, will be a great way to support the NHS.
Just quickly before we move on to other things, how many of the 18,000 contact tracers have been hired so far?
I don't know the answer to that, but that's actually, I think, fairly straightforward. This is not something which requires
Why don't we know the answer?
days or weeks or months of training. It's not my particular area of policy, that's all, but it's not an issue because the app isn't going to be available for some time yet, a few weeks yet. But when it is there, we will have the people in place. It's not, I don't want to get into another, so we had this with 100,000 tests, I realise, and as you saw, we ended up meeting and exceeding the numbers. We'll have the 18,000 contact tracers in place. It's not a particularly complicated thing to do, and as you've seen, people are more than willing to come forward and be incredibly public spirited when it comes to defeating this as a nation.
OK. Now, the Prime Minister said on Thursday, the objective of this government is to save lives. That's been our objective from the beginning. But more than 28,000 people have now died after testing positive for COVID-19 in the United Kingdom. Only the US and Italy have seen more deaths. I mean, the government's own graph that you've been showing at these press conferences shows that we're on track to actually overtake Italy as well. By your own metric, haven't you failed?
No, I don't agree with that. I mean, first thing to say is that every death has been an absolute tragedy. I know quite a number of people who've been affected by this disease, as virtually everybody will know people now. But I don't agree with that for a whole variety of reasons. We need to be very, very careful at the way we assess this information, as Professor David Spiegelhalter pointed out in The Guardian this week. Simply looking at that raw data doesn't actually tell you the story. What you need to look at is excess mortalities over a period of time.
Let's look at the excess mortality in that case then, because, as you say, Chris Whitty as well, the Chief Medical Officer, says that's the best way perhaps to look at it. But when you look at excess deaths, that's the number of deaths per week above the normal average, you can see that other countries have had a spike but have fallen, but England's line is far higher and still rising. So even if you look at the excess mortality data, the government has still failed to keep the deaths down.
That Chris Whitty and others would make is actually you need to look at that over a much longer period of time. So we'll have to look back over a year. I'm afraid, not to be evasive, we just won't have that information.
But we only had the data available at the minute, and the available data shows that the government has not been keeping the deaths down in the same way that some other countries have.
So as I say, it is much more complex than you're making it sound, for the simple reason that there are other factors to take into account on excess mortalities, which we won't know about today. For example, what does it do in terms of other illnesses and diseases, and what was the impact of, for example, the fact that we were able, unlike in many other countries, Italy being an example, who have usually a first-class health system, but have found their hospitals completely overloaded, whereas we've managed to maintain critical care space against what everyone thought was likely at the beginning, and ventilators and all the rest of it. So you have to look at the whole picture, and that information simply isn't available as yet. But as scientists point out, there will be a whole range of things that need to be looked at. Obviously, the demographics of the country, age profiles, things like obesity. We know that people in different health categories with underlying problems fare differently in different countries, have different levels of these sort of things. Geography, density of cities like London, for example. So there's a huge amount of different things to look at, and I just caution, as the medical experts do, that we shouldn't look at the raw data and jump to conclusions on this, because actually the NHS has been doing a terrific job, and there will be other deaths outside of coronavirus that may or may not have happened had it been handled differently, without, for example, sufficient hospital capacity.
Another area where we've seen, sadly, a lot of deaths is in care homes as well, just finally. We've heard stories about care staff not getting sufficient protective equipment. It was only 2.5 weeks ago the government said it would start testing everyone in care homes that had symptoms. We've also even seen cases of people being moved from hospitals to care homes with COVID-19. So why did it take until mid-April to start testing people being discharged from hospitals into care homes? And have people in care homes been abandoned?
First of all, I don't think there's any, be absolutely straight with people that in terms of getting enough PPE, it has been enormously challenging. The whole world is after this protective equipment. We've managed to, having said that, deliver well over 1 billion pieces now, millions more every single day, including to care homes, where it is now not only possible to be tested if you are symptomatic, but asymptomatic care home. Both patients and carers can now be routinely tested. So there have been massive improvements, but I don't think, this is not unique to us. I saw doctors, care home workers holding a protest outside the German Bundestag for exactly the same reason in Germany, a country often held up as doing well. So this is just a massive issue, of which British companies have come forward in extraordinary numbers. Over 10,500 companies have come forward to offer help with PPE, and we are doing everything we possibly can. Paul Dayton, the guy who ran the Olympics so successfully in this country, now in charge of getting all of that distributed to the right places and so on and so forth. But I don't, there is no other way to say this. It is not an easy task to get that level of PPE to the right places, but it is flowing now, and both for residents and for people working in care homes. And my heart goes out, and again, I know people in this situation where lives have been lost in care homes or in the community in general, or in hospital. This is a terrible disease, and we are all fighting it just as hard as we can.
OK, Grant Shapps, thank you very much for coming on the programme and talking through the government's response. Thank you very much.
Thank you.